You've been looking at your blood pressure wrong your entire life. Two numbers. You see them every time, but one of them is far more dangerous. And after age 60, it can silently kill you. The terrifying part is this. Most people focus on the wrong number. They feel safe when they shouldn't. Because the real danger doesn't hurt, doesn't warn you. It builds quietly, day after day, until one moment, a stroke, a heart attack, a life changed forever. And by then, it's too late. Today, you're going to learn which number is truly dangerous and why ignoring it could cost you everything. I've spent over 20 years working with damaged hearts. I've seen strokes that steal speech, movement, independence. I've seen families collapse overnight, not because people didn't care, but because they misunderstood one simple thing: blood pressure. They watched the wrong number, trusted the wrong signal, and paid the highest price. What I'm about to share is not theory. It's based on real patients, real outcomes. If you're over 60, this matters to you. Comment 1 below if you're ready to protect your life. Let's make this simple. Your blood pressure has two numbers. The top number, called systolic, this is the pressure. When your heart pushes blood out, think of it like a wave crashing. The bottom number, called diastolic, this is the pressure. When your heart rests, the calm between waves. So if you see 150 over 90, that means high force at the peak and pressure even at rest. For years, both numbers mattered equally. But new research shows, after a certain age, that is no longer true. Let me show you how dangerous this misunderstanding is. Margaret was 73. Her blood pressure, 165 over 70. She smiled and said, "My bottom number is perfect." She felt safe. But 6 months later, a massive stroke. She lost movement, lost speech, lost independence, all because her systolic number was ignored. Now, Robert, 68 years old. His reading, 128 over 95. He was terrified. He thought his bottom number would kill him. But after full testing, his heart was stable. His risk was far lower than he feared. Two people, two numbers, two completely different outcomes. One mistake, focusing on the wrong number. So now the real question is, which number is actually more dangerous, the top or the bottom? Here's where most people get it wrong. They assume both numbers carry the same risk. But that's not true, because your body changes as you age. What's dangerous at 30 is not the same at 60. Your arteries change. Your pressure changes. Your risk changes. So the answer depends on one thing: your age. And if you're over 60, the truth you're about to hear could completely change how you see your health. Massive studies followed millions of people for decades, tracking heart attacks, strokes, and death. And they all found the same pattern. After age 60, the systolic number becomes the strongest predictor of danger. Not equal, not similar, but 2 to 3 times more powerful than the diastolic number. This means that top number is the one most likely to decide your future, your risk, your survival, your life. If you're over 60 and you've been ignoring it, you need to pay attention now. Comment 1 below if this changes how you see your blood pressure. Here's something even more dangerous. Many older adults have high systolic pressure, but normal or even low diastolic. This condition has a name: isolated systolic hypertension. For years, people thought it was harmless, just part of aging. But that belief was completely wrong. This condition dramatically increases your risk of stroke, heart attack, heart failure, and kidney damage. It looks safe because one number is normal, but underneath, damage is building silently every single day. This is exactly what happened to Margaret, and it's happening to millions of people right now. So let's make this crystal clear. If you are over 60, the most dangerous number on your blood pressure reading is the top number, systolic. This is the number that predicts stroke, heart attack, and death. This is the number that silently damages your organs with every heartbeat. And this is the number you cannot afford to ignore. Because even if the bottom number looks perfect, you may still be in serious danger. To understand why this happens, you need to picture your arteries. When you were younger, they were soft, flexible, like elastic. Every time your heart beats, they expand, absorb the pressure, and protect your body. But as you age, something changes. Those elastic walls become stiff, thicker, harder, less forgiving. Now imagine your heart pushing blood into a rigid pipe. There's no cushion, no absorption. So the pressure spikes higher and hits harder. That spike is your systolic number rising. With every single beat, at the same time, your arteries don't bounce back anymore. So the resting pressure doesn't stay high. It may even drop. This creates a dangerous gap. High peaks, low rest. And those repeated impacts, again and again and again, are slowly damaging your brain, your heart, your kidneys. Not all at once, but silently, over years, until one day, the damage becomes irreversible. Now, here's what that pressure is actually doing inside your body. Let's start with your brain. Those tiny blood vessels are not built for constant high force. Over time, they weaken, they narrow, they can even rupture. That's how strokes happen. Sometimes suddenly, sometimes silently. Small areas of your brain begin to die. You may not notice at first, but slowly, memory fades, thinking slows, personality changes. Now your heart, it has to push harder. Every single beat against that rising pressure, so it thickens, trying to keep up. But a thicker heart is not a stronger heart. It becomes stiff, less efficient. This is how heart failure begins. And your kidneys. They filter your blood every minute through delicate vessels. High pressure damages them, little by little, until they stop working. And once they fail, your blood pressure gets even worse. This is not one big event. It's slow damage, happening quietly every single day. Now here's where things get confusing. Some people think, if my bottom number is low, I must be safe. But that's not always true. In fact, in many older adults, you can have very high systolic and very low diastolic. This creates a wide gap called pulse pressure, and that gap is a warning sign of stiff, aging arteries. But there's more. Your heart muscle receives blood during the resting phase. When diastolic pressure is too low, your heart may not get enough oxygen. Even if your arteries are open, this can lead to chest pain or even heart attacks. So low diastolic does not mean safe. It can be part of a bigger danger. So what should you do with all of this? First, know your numbers, not once, but regularly, and pay close attention to your systolic. If it's above 130, you need to take it seriously. Second, lifestyle changes are powerful. Reduce salt. Processed foods are the biggest source Lose excess weight. Even a small loss can lower pressure. Move your body daily. Walking, swimming, cycling, all improve artery function. Limit alcohol and manage stress. These are not optional. They are your foundation. But here's the truth. For many people over 60, lifestyle alone is not enough. Medication is often necessary. And that's not failure. It's protection. Modern treatments are effective and widely used. The goal is simple. Bring that systolic number down safely, consistently, because controlling it can prevent strokes, heart attacks, and even dementia. Let's turn this into action. Because knowledge without action changes nothing. First, check your blood pressure. This week, not later. Not next month. This week. And don't just look at both numbers. Focus on your systolic. Second, if that top number is above 130, talk to your doctor. Don't ignore it. Don't assume. You're fine. Third, build daily habits. Reduce salt. Move your body. Control your weight. Manage stress. These small actions add up. Over time, they can lower your pressure naturally. Fourth, if medication is prescribed, take it consistently, not when you remember, not when you feel like it, every single day, because consistency is what protects you. And finally, track your numbers at home. Write them down. Understand your pattern, because the more you see, the more control you have over your future. I want you to remember Margaret. She thought she was safe because one number looked perfect, but the real danger was the number she ignored, and it cost her everything: her independence, her voice, her life as she knew it. Right now, there are millions of people just like her, walking around believing they're fine because no one explained this clearly. But now, you understand which number matters and what it can do if left uncontrolled. So don't keep this to yourself. Share this video with someone you care about, a parent, a spouse, a friend, because this knowledge could save a life. And if you want more clear, real, life-saving information, subscribe now. Your heart has been beating for decades. It deserves your attention. And now, you finally know what to watch.